Thank you very much, and I want to thank the organizers very much for asking me to talk with you this afternoon. When we think about climate change and health, we can, first of all, a point I'd like to make very strongly is health integrates all of the impacts that you've seen. That all the changes in the climate, the changes in the ecosystems and biodiversity ultimately will affect human health. And when we think about those impacts, we can think about them in two quite broad categories. There's the very direct impacts. You've heard reference to heat waves, to storms and floods. Those affect all of us very directly. The largest impacts are going to be indirect, where changes in climate, changes in ecosystems will change something that will then change where we see patterns of disease. They'll change where mosquitoes can live. They'll change how fast pathogens can replicate. So they'll make some kind of alteration in the system that will then have an impact on human health. These indirect impacts are much more difficult to study because it's much more complicated. All of the health outcomes we are concerned about with climate change, the direct impacts, heat waves, floods, droughts, windstorms, and the indirect impacts on food and waterborne diseases, vector-borne diseases, and any kind of disease related to air quality, air toxics or air allergens, are all affected by things other than ecosystem change, other than climate change. So we have to take into account that there's other drivers of these diseases as well, and that they will influence the patterns that we see in the future. So we need to take that into account when we're looking at what the impacts might be, because it determines where we see those diseases now, and then how can we think about how those changes will affect where we're going to see them in the future. I'm only going to focus on climate change. All of us working on this issue are aware of the complexity of the problem. There's a very limited research base on which to base much quantitative estimation, but that certainly is going to be improved in the future. One of the conclusions of the Intergovernmental Panel on Climate Change, the fourth assessment report, the Human Health chapter, is on the direction and magnitude of the health impacts. And this slide summarizes that. The arrows are qualitative, they are not quantitative. They're relative to each other. The size and the length of arrow just gives a sense of how big we think the problem is going to be. You can see that the largest impacts worldwide are on malnutrition, diarrheal diseases, and malaria. One point I'd like to make is in doing a scientific assessment, there's rules on how you do the assessment. And you can see that the impacts are within confidence bounds. And the confidence has to do with the quality of the literature. And so if you look at the bottom, there's medium confidence that diarrheal diseases will increase with climate change. Any public health professional working in an area of the world that's water stressed will tell you that if water availability goes down, diarrheal diseases go up. So there's very high confidence from a public health perspective that when we look at the water-stressed areas, diarrheal diseases will likely go up unless we implement new interventions. However, the literature projecting what's going to happen with diarrheal disease and climate change is very limited. To go back to my previous point, we know there's lots of drivers of these health outcomes. We don't have enough research to do quantitative estimates, but we do have a lot of confidence from 150 years of experience in public health on what can happen in a changing climate. And I want to talk about some of the health impacts for a minute. I've got not too many slides. To again come back to make the point that health integrates across all the other impacts. You've heard about heat waves. This is a photograph taken by Michael McGeehan at the Centers for Disease Control and Prevention in a heat wave in 1995 in Chicago. It happened during an event called the Taste of Chicago, which is a quite large festival in Chicago. Besides bands and people selling things and lots of activities, a whole range of restaurants bring food in to advertise at their restaurants. During the course of the heat wave, there were about 600 excess deaths, so 600 more people died than you would have expected during that time of year. And this is a photo that Mike took from the back of the coroner's office. It's 3 of the 9 refrigerated trucks that the coroner's office commissioned from the restaurants to bring the food in to hold the bodies that they couldn't hold in the coroner's office. And you heard this morning about urban infrastructure, and think about what you saw for heat waves and what this means for how we have to think about our urban infrastructure and how these impacts are going to interact and will affect our cities in a variety of different ways. Extreme weather events, you heard lots of comments about that this morning and this afternoon. They are increasing in frequency and intensity and duration, and by and large, we're not terribly well prepared. As a public health professional, I focus on the extreme weather events, the very large events, because that's where you see the greatest health impacts. But all of our lives are going to be affected by increases in more precipitation. In particular, I live in Washington, D.C., and a story I like to tell when I'm not in Washington, D.C., is about a year and a half ago we had a heavy rain event. It was not a record. Nobody died. I doubt anybody was really particularly affected. But we flooded office buildings. In fact, part of the federal government was shut down for 3 days because office buildings were flooded. And I'm not going to say if that's a good thing or a bad thing. But who's talking to the building managers? In fact, about a month or so ago, there was front page headlines in the Washington Post that because of these kinds of events, our Federal Emergency Management Association was going to say that part of downtown Washington, D.C. is now a floodplain, which changes all the requirements for buildings. And there was article after article about why this should be done and about the problems that this was going to cause to address it. And we can have these debates and we can argue back and forth. In the meantime, the weather is going to keep doing what it's doing, and we've got 50 years of climate change built into the system. And we're not as prepared as we think we should be. Ozone causes significant respiratory problems. Anybody who's got any kind of respiratory problem, asthma in particular, older adults, people with chronic obstructive pulmonary disease. And ozone is formed on a clear, cloudless day, like it is, I think, outside, if we could see outside. And the rate at which it's formed is temperature dependent. So if you keep everything constant and make it warmer, you're going to have more ozone. And these are some projections for the New York City region, where you can see a 7% increase in mortality from ozone-related diseases. There's also significant morbidity associated with ozone, and it's fairly difficult to control. We keep changing regulations, but there's many places, certainly in North America, that are out of compliance because of natural reasons for ozone formation. It's going to be more difficult to control in the future. Vector-borne diseases, the current geographic range of many of them is determined by temperature and precipitation patterns. This is some modeling work that's done by Dr. Ogden, who's in Montreal, looking at Lyme disease here in Canada. Lyme disease did not exist in Canada several decades ago. It showed up recently. Canada has been mounting a fairly large response to monitor where it is appearing. You can see the projections showing what would happen by 2020. I don't remember, no. And if I didn't put the map in, by 2080, essentially all of Canada would have a climate that's suitable for Lyme disease. Whether or not there actually is Lyme disease will depend on more than whether the climate is suitable. It's going to depend on the interactions of the tick with its environment. It's going to depend on the kind of control programs we put in. This is just looking at whether you could have it, and the answer is you could. And this is just one of several diseases where the various vectors that carry these diseases seeing opportunities. And we know historically that they're very good at exploiting opportunities. They currently have boundaries. The boundaries, though, are shifting because the boundaries have to do with when does it freeze, when is it too wet, when is it too dry. And as those change, they're just going to keep moving with the changing weather patterns. Many food and waterborne diseases are temperature dependent. There's a range of studies looking at salmonella and other kinds of foodborne disease. In the countries that have looked at this, particularly at salmonella, each country that's looked at it has seen that there's a linear relationship between ambient temperature and salmonella. We're not controlling salmonella as well as we'd like right now. Salmonella is a big problem at the moment in the States because of tomatoes from, I forgot if it's Florida, and there's been quite an outbreak of it across the States. It's warmer. The pathogen is going to replicate faster, and it's going to become a larger problem. Right now, the U.S. has about 350 million cases of enteric disease every year, self-reported, and about 15% of that is due to Salmonella. It's becoming warmer. It's more likely we'll have more cases. And are we prepared? I've said several times I don't think we're prepared. The Environmental Defense Fund, George Mason University, and the North American Association of County and City Health Officers did a survey that was released on Earth Day, so released in April. And you can see this is one of several questions that was asked of these health officers, and basically, do you have the expertise to address health risks? Some of the prior questions to these health officers were, do you think climate change is a problem? About 3/4 said yes, they think it's a problem now. Almost all of them said yes, they think it's going to be a problem in the future. And are you ready? Can you address it? And 3/4 or more said no. We really don't have what we need to be able to address the risks of climate change. So thinking about recommendations for the kinds of work that you are engaged in, there's a lot of collaboration across the North American continent on public health issues. We know we need to increase the resilience of those public health systems to deal with the kinds of risks that climate change is presenting. So I've got a short list that's listed. Essentially, we know that there's lots of programs, but the programs are not specifically looking at climate change. So they're not taking on board how the risks that people are facing today might change in the future. And I think one of the most important messages that has to come out of those of us who work on climate change is to get people to really understand that the future is going to be very different than the past. We don't know exactly what it's going to look like. There is uncertainty, but we are certain it's going to look different. And then how do we start structuring things different? So as the previous speaker said, we've got a lot more flexibility. What happens if we have a major storm and we have to test millions of wells to determine if drinking water is safe? There's almost no state, no single province that would have the capacity to do that. Can we find ways to collaborate so that we can reinforce each other, we can provide the support that would be needed when you have a major event? Are we collecting our data in similar ways so we can provide comparisons to see indeed if diseases are changing their range? Are we providing the tools that people need to be able to work effectively and be able to really increase the resilience of population health in facing the risks of climate change? Another area in which we need to focus, in which there's been very little done, there's a lot of policies that are being discussed and beginning to be implemented to address the risks of climate change. And historically, all environmental science will tell you that people put policies in place, and some of them have adverse consequences for human health. And some of those adverse consequences can be quite large. And we should learn from that history and be very proactive about saying we have to do health impact assessments. Are we going to do carbon capture and storage? If we are, there are health risks. How are we going to address them? And let's do it now, when we know what those risks might be and we can set up the monitoring and evaluation programs instead of waiting until there's a problem. And with that, I will say thank you, and I think I'm actually on time.